we're just gonna briefly talk about the pulmonary circulation, because again, when I map out the heart for you and you walk through it, you will know all of this. So far as leaving the right ventricle, going through the pulmonary semilunar valve to the pulmonary arteries to the lungs, we're going to be going big arteries, arterioles, capillaries, then we'll come back venules, and see, this is an actual vein that is going to be oxygenated. Venules, veins, then into the left atrium. So, like I said, don't stress. We're gonna do some activities with that stuff where you will know it like the back of your hand. You're gonna know all the circulation of the heart, all of it. And it will seem easy to you by that time.
Was that it?
No, it should be going. It's buffering. Not going to load. I'm going to move on.
I need money. There's only one donation session in here, that's me.
Okay, really wasn't going to load, so I'll move on. Again, all of this stuff, all the arteries and the veins, all that we will, you'll actually build on your babies. And you guys that are not going to HOSA will do that tomorrow. So, don't worry about this just yet.
Wait, so are we not taking a test tomorrow?
We are not taking a test tomorrow.
When are we taking it?
When we're done with all of the lecture and all the other activities that go along with it.
Oh, thank God. 'cause I was working
these
tonight
worksheets
and
I know.
tomorrow.
So then the worksheets are not due tomorrow, yes.
So do we have to do
Now, for our people that are not going to HOSA, yes, your worksheets are due tomorrow at the end of the day. So you should be able to get all of that done. Those that are going to HOSA,
Yeah, because
if you're going to HOSA, then you get a buy.
I've been working these
So
last
if
4
I'm not
days
going
at
to
Dick's.
HOSA, are they due tomorrow?
Yes.
If we are going to HOSA, when are they due?
So do we take
When we
a
get
test
back.
I've been working
Yeah.
so many hours.
It'll be
a day.
test day.
Usually by day, we
I
have
don't-
a whole bunch of coloring.
Maybe Wednesday or Thursday. Not. It depends on how fast we get through everything, because we've got a bunch of stuff to still do. Okay, pulses. You do need to know where your pulses are, and these are just arteries. So your carotid up in the neck, brachial we found when we were doing blood pressures, radial you found when you were doing pulses, and then your femoral artery, you've got a really large femoral artery. And this is another good place to take babies. You can do brachial arteries on the inside of the arm when we do on babies. When we do CPR, you'll be doing that. Popliteal, so behind the behind the knee, and then your posttibial arteries. These are a couple of little tricky ones to find. So you have to really press down and be able to feel those. Your dorsalis pedis, or what we call your pedal pulse, this is very important. As nurses, when you do a head-to-toe assessment, you assess that every time you go in and assess that patient, because you got to make sure that they're getting circulation. If you can feel a pulse down there in that foot, then you know everything else is getting blood. If you can feel it way down here, and if you can't, then you have to get a Doppler out. And the Doppler will actually roll it over, and you can hear the pulse. Kind of like when you hear a Doppler on a pregnant belly, and you hear the baby's heartbeat, and it's going.
So beautiful.
That's the same way it sounds on that pedal pulse when you do a Doppler. We got to make sure they have blood flow down there. Talking about pulses, Another way to assess blood flow is not only just feeling the pulse, knowing that it's there, but then feeling the warmth of the hand, looking at it, whatever extremity you're looking at. Is it red or is it ashen? Is it blue? I mean, what color is it? Because that would tell you whether they're getting circulation or not. Nail beds, doing a cap refill. You can do it on the fingers and the toes. So it should be within less than 3 seconds when you pinch their nail bed and then let go and you see it pink back up. That's doing a cap refill. Same thing with your dogs and your animals. When you pull up their gums and you press on their gum, it's like doing a cap refill on a human. So they should pink back up within seconds, unless they have black gums, and that's kind of hard to do. Okay, so this we will learn when we build our babies again, do arteries on our babies. So don't worry about this stuff just yet. We may mention this. We're not going to build a circle of Willis, but it is a huge network of arteries that are supplying the brain. This is where you can have some of those really bad things happen. You can have a aneurysm anywhere along this network, and if you do, then those patients usually are gone very quickly. This isn't normally something that happens over time, like your berry aneurysms. This is probably something they're born with. And these would be those people that just drop dead. They're in the middle of a basketball game and they drop dead. We'll do the veins as well as the arteries. We'll do all that. Hepatic circulation, very hairy, and we will do this when we do our cardiac circulation. I will add in hepatic. This will come back and bite you again when we do digestive system. Don't worry about it. We'll know that at the end. Talking about pressures. So this is extremely important because when it's coming off of that very first branch, that's the very first squeeze going into that aortic arch, you're going to have the highest pressure possible. So, you know, within normal ranges would be at 110 to 170, 120s. But that it's going to slowly decrease as it comes down. The importance of that is we do need a little pressure here in the capillaries, but we don't want a high pressure like this, because if it comes through there blowing through those single layered capillary bed, it's going to blow them. So they're going to all bust open. So that's why it's very important to regulate that pressure. We're going to look at some chemicals in a minute that regulate the pressure. Now, as it's going into the venules, veins, larger veins, and then that huge vena cava where we almost zero out, there's some important aspects of how do we get that pressure back to our heart. So how do we get it to dump back up into that right atrium? And that is three things. Number one is you actually walking around and moving. Our bodies were made to move. So when you're walking around, you're contracting muscles that are going to help get that blood back to the heart. So I want to look at something and show you. So muscles in the legs contracting as I walk around will help get that blood back to the heart. So here's our muscles contracting. We even have respiratory muscles. When we're breathing, will help push on those veins that are all around the thoracic cavity, helping it dump back into the heart. Also, inside these vessels, these veins, we have little bitty valves that help. So as the blood's dumping down, the next valve will be closed, and as that muscle squeezes, it's pushing back up, and then it will kind of fall down and trap in those. So this is what this one's depicting. So as blood's coming, it's filling up from the feet and things, we contract, blood will actually go push up because our muscles are contracting. And then after they relax, the blood will start to run back down because of gravity, but it'll catch in these valves. So that's what this is showing right here. It's catching, and here is showing it catching those valves. So then the next squeeze would get it up to the next valve, and then it would run back down, catch. Next squeeze would get it to the next valve, like a step ladder all the way back up to the heart. So muscle contraction helps get the blood back. These valves help get the blood back. And then last is your hydrogen bonding or water tension helps get the blood back. So one water molecule attracting the other molecule, and as it's being squeezed up, it's pulling the other ones behind it up to the heart. So there's three things that help get the blood back to the heart when we have no pressure whatsoever. Blood pressure. There is some things that that are affecting our blood pressure. So cardiac output, more blood that's squeezed by the heart will obviously increase our blood pressure. Less blood squeezed by the heart, which is cardiac output, will lower our blood pressure. If our blood volume is really high, then our blood pressure will be really high. So if we got a lot of water in our blood, the blood pressure will be higher. If the volume's low, obviously it'll be lower. There are some things that cause resistance in our blood. So high resistance, like with atherosclerosis or arterial sclerosis, where we have hardening of the arteries, or we have plaque with with smoking that creates a lot of plaque. High fat foods create a lot of plaque. Then we actually decrease the diameter of those arteries, and so now the resistance, it's harder for blood to get through there because now it's squeezing through a really narrow artery. That increases resistance, which decreases our flow. So we're not getting much out on the other end, but what we are getting out is really high pressure. So it's just like taking a water hose, decreasing that diameter with your thumb. So not as much water's coming out, but it's shooting across the room now. So the pressure is harder. Less volume, but harder. That's because of resistance. Think high blood pressure does that. Decreased resistance, the flow is decreased. So if I remove my thumb off that water hose and it's just dribbling down, the flow, I've got more volume, so that does increase, but the pressure is low now. I'm not going to spray off the paint with that pressure. Some things that can increase the resistance is the viscosity of blood. So that's how dry it is, how sticky and thick it is. So if you're dehydrated, then your blood viscosity is going to be higher. So it's going to be sludgy. Your blood's not going to move as quickly through the vessels. Not good. Vessel diameter. So if it's narrowed, it's going to increase your blood pressure. So here's an example of vasoconstriction. So where those vessels will actually, the smooth muscle around it will constrict and decrease this diameter. So it'll increase the pressure but decrease the flow. Vasodilation, where they'll get big and fat. So the pressure will drop. This is your blood pressure will be lower if they're big and fat. There'll be more blood moving, but it'll be lower pressure. Blood velocity we talked about, really high here. As we get capillaries, pressure, the blood flow will decrease, and then the pressure gets lower and lower and lower, but the volume gets bigger and bigger. We move more. Usually expected to accompany atherosclerosis, a disorder of the arteries, lose elasticity, fatty materials build up. So they actually will decrease the diameter with atherosclerosis. So what type of problem will you have? High blood pressure for sure. Okay. Let's look at some of we have looked at this actually. We talked about the parasympathetic and sympathetic nervous system in last lecture in chapter 14. So if your blood pressure is too high, then your parasympathetic, which is paralyzing the stress part of you. So you're gonna relax and you'll dilate those vessels so the blood pressure will drop. So again, just like the water hose, you'll remove the thumb, the pressure will go down, and so it's just dribbling out. Whereas if you're stressed with sympathetic, so this will happen if your blood pressure's low, we want to increase it. Those vessels will constrict. We'll put our thumb over the hose and it will shoot out, giving us a high blood pressure. Let's see if our video will load on this one.
The vascular system can quickly adjust blood pressure and alter blood flow to respond to the body's changing needs. One way it does this is through input from the nervous system. Specifically, an area of the medulla in the brain, called the vasomotor center, will, when stimulated, send impulses via the autonomic nervous system to alter blood vessel diameter and therefore blood pressure. Baroreceptors in the carotid sinus and aortic arch also detect and respond to changes in blood pressure. Baroreceptors transmit signals along the glossopharyngeal and vagus nerves to the cardiac control center and the vasomotor center in the medulla. If the baroreceptors detect that the pressure is too high, the medulla will increase its output of parasympathetic impulses. Parasympathetic impulses cause vasodilation. Then the heart rate and the stroke volume also decrease, and blood pressure drops. If the pressure is too low, the medulla will increase its output of sympathetic impulses. Sympathetic stimulation results in vasoconstriction. The heart rate and the stroke volume also increase, and blood pressure rises.
Okay, so there are a whole bunch of hormones that help bring our blood pressure up. And then there's one little one that will help bring it down. So, you know, we have problems with high blood pressure, but those problems are not normally acutely. They happen over a long period of time. So that's why it's so important to make sure our blood pressure stays where it needs to be at whatever level we're wanting it, whether it's 110/80 or whatever. But so that's why we have several hormones, because if your blood pressure drops, then that will you will die very quickly. You can't live with a pressure 60/40 but a few minutes. Whereas high blood pressure, you can live 150/90, 160/90, you know, even 200. You can live with that for a while. So we have renin and angiotensin 1 and angiotensin 2. So renin will help convert angiotensin 1 to angiotensin 2. Don't stress about any of that jazz just yet. Just know that these things are coming from the kidneys. The kidneys are the ones that are going to release and cause themselves to retain sodium. So they'll hang on to some sodium. Aldosterone, same thing. We hold on to water and sodium. Your antidiuretic hormone causes the decrease. So think about diuretic. Diuretic makes us pee, whereas this one is an antidiuretic, so it's going to hold on to the fluid again. Epinephrine and norepinephrine will cause vasoconstriction, increase in blood pressure. So all those hormones, which we will look at again in the endocrine system, so don't stress about them just yet, but they help to bring our blood pressure up. This one here, your arterionatriuretic peptide, is sitting in your carotids as well as your atrium. And it's detecting the pressure, the stretch of that atrium. When it's all stretched out, then it knows the blood pressure is high because we got a lot of volume. So this one will cause the release of sodium. And remember, where sodium goes, water follows. So if I get rid of sodium, then I decrease the blood volume. I'll start peeing out fluid, getting rid of it. We talked about how we get blood back up to the heart. Rises with structure, sends out parasympathetic impulses. Okay, what was it from the video that's sending impulses? It sends out parasympathetic as well as sympathetic. It was a main guy there. The medulla does that. He sends out all the information from the brain stem itself. Okay, that's chapter 15 very quickly in a nutshell.